Are your shoulders really frozen? Frozen shoulder is a condition in which patient experiences pain and gradual loss of movement in the shoulder. I just want to start with a brief history. I'm Rafi Ahmed, physical therapist specialized in chronic pain management. This term was coined by American doctor E. Coleman in the year 1934. He hospitalized four people, tied their arm into elevation for about 20 hours per day, took them out of bed once a day for pendular exercises. And the real irony is that he has mentioned in his book that after 2 weeks of painful intervention, they get better. In 1945, Neviazer came out with the term adhesive capsulitis, which he meant was the capsule of the shoulder joint was sticking to the humerus. In 2014, Professor Jeremy Lewis came out with the term frozen shoulder contraction syndrome. This condition is typically described as passing through three stages: freezing, frozen, thawing. The freezing of the painful stage, here the patient experiences severe continuous pain, especially at night, causing sleep disturbance, and there is gradual loss of movement. This may last between 10 to 36 weeks. The next, frozen or the stiff phase. Here the pain decreases and the joints become more stiff. You have difficulty in your daily activities like dressing, combing, and toileting. This stage may last between 4 to 12 months. The third is the thawing or the recovery phase. Here you regain your movements to a near normal stage. This may last between 5 months to nearly 2 years. But the simplest two-stage model proposed by Professor Jeremy is pain greater than stiffness and the stiffness greater than pain. The 2017 UK Frost study, which is the largest clinical study, shows that the pain greater than stiffness phase may last up to 9 months, which means patients reported severe pain till 9 months, and the condition may take about 4 years for complete resolution. Your frozen shoulder can be of two types. It can be primary or secondary. In primary, there is no known cause. We call it as idiopathic. Secondary can be due to trauma, surgery, diabetes, thyroid dysfunction, or lipid disorder, which means you have increased cholesterol. So if you're a diabetic, or if you have thyroid dysfunction or cardiovascular disease, then you are more prone to frozen shoulder. On the other side of the story, I can tell that the diagnosis of frozen shoulder can be a warning sign of early diabetes, thyroid dysfunction, or cardiovascular disease. The incidence of frozen shoulder is 4 times higher in women than men. What are the signs and symptoms? In primary frozen shoulder, usually your pain is triggered by lifting a small carry bag or just reaching the back seat of your car. Initially, you have dull waking pain in the shoulder joint and the middle of your arm during movements. Gradually, there is loss of movements, making it hard to perform simple activities like reaching your back pocket or your brassieres. There is difficulty in sleep lying on the affected side, usually in the initial stages. A 2022 study by William King showed that patients with frozen shoulder have a higher degree of anxiety, stress, emotional disturbance, depression, as they are unable to participate in social activities. Patient reported that they are living in no man's land, which means they are uncertain about the condition, what is going to happen, how is going to proceed. How to diagnose frozen shoulder? There is no definitive gold standard test as such to diagnose frozen shoulder. The patient is usually between 40 to 65 years of age. In Japan and China, it is called a 50-year shoulder. The range of motion in the shoulder joint is both actively and passively restricted. When you move the shoulder joint actively, your therapist cannot take it beyond that range, which means the active movement and the passive movement both are equal. And you should have a normal x-ray. This is according to the British Elbow and Shoulder Society. X-rays are required to exclude other conditions like log dislocations, arthritis, fractures, avascular necrosis, and osteosarcomas that may restrict movement and masquerade as your frozen shoulder. In the early stage, you may not have any full-blown stiffness except for severe pain, especially at nights. So you need to follow up in the next visit to see how the condition progresses. Let's dive into see what is happening in your shoulder probably. In frozen shoulder, there is chronic inflammation in the synovial membrane of the joint. As a result, there are higher number of myofibroblasts. These are cells which are involved in the inflammatory process after any injury. This results in progressive fibrosis and eventual contraction of the capsule of the joint, which causes pain and stiffness. Actually, a joint capsule is an articular structure that surrounds the shoulder joint, and the inner layer of the capsule is called synovium. So here, the capsule, the subacromial bursa, the coracohumeral ligament are all thickened, and there is tightening of the subscapularis muscle, which moves your shoulder internally. Adhesions of the capsule to the humeral head do not occur, which means the capsule is not sticking to the humerus. So we do not use the term adhesive capsulitis. So all this information are really important in the treatment, how to combat the fibroblast, what can be done to the capsule, and so on. Another thing which occurs in the shoulder is subconscious guarding. So what is that? During inflammatory process which occurs in the shoulder, as we described above, the body subconsciously shuts down the movement in the joint. It wants to protect the joint against further damage. Now, this then develops into a neurological inhibition, which means the brain is inhibiting the movement in the shoulder now. In a 2018 study by HOLLMANN et al., they took a sample of 5 patients with frozen shoulder indicated for surgical release of the capsule. They put them under general anesthesia, and they found that there was significant increase in the passive movement of the shoulder in abduction and external rotation compared to the movement when they are awake. So under general anesthesia, the range of movement was more. This suggests there is fear-based brain-induced movement limitation and muscle guarding in the shoulder, but not true capsular contraction. So this may be a contributing factor in many of the patients, although more research is needed to determine the number of patients suffering from this type of frozen shoulder. And that's what our team has been working on. So it is stiff but not frozen. This is called functional freezing. So what are the treatment options available for frozen shoulder based on the stages or possible muscle guarding? Stay tuned for more information. Please like and share this video with your families and friends, and subscribe our channel Mind Over Movement for more information on pain. Thank you.